In the beginning of the pandemic, traveling nurses were in high demand, going wherever the epicenter was in this country. But with the Delta variant, the epicenter seems to be everywhere. These travel nurses are still in very high demand, and we're learning tonight they're often getting paid more than nurses who stay at the same home hospital. WCNC Charlotte's Lana Harris has the story.
While the vaccine may have helped most regain a sense of normalcy, the pandemic has only continued to take a toll on nurses.
It's the first time in my career that I've almost seen nurses at the point of mental break.
Meka Douthit with the North Carolina Nurses Association says in the beginning, nurses were emotional support for patient after patient, death after death.
It's like being in war for the past 2 years.
And after a brief decline, Adele says COVID cases are back on the rise, compiling onto their surgical and emergency patients.
We're taking patients in, our EDs are backlogged, our ICUs are near capacity. Nurses are asked to work a little bit longer to support the needs. So they're picking up extra shifts.
A survey by the North Carolina Nurses Association found 41% of nurses reported a severe staffing shortage at their facility, and 59% have had to work longer hours. Adele says travel nurses are now being used across the state to fill in gaps.
Now, since COVID it's like everywhere at the epicenter. So everybody's having to increase their capacity to take care of it.
But Adele says travel nurses can make significantly more than nurses who stayed with a home hospital, with the potential to receive stipends for food, housing, and mileage, along with sign-on and referral bonuses.
I mean, you can hear things about thousands of dollars of bonuses.
Adele says it can be frustrating for home hospital nurses doing the same job, making less.
It is discouraging, and they do talk about it, but we do at the same time want to recognize those that stay and provide the care.
Adele says it is causing some employers to look at ways they can incentivize those workers too. Lana Harris, WCNC Charlotte.